What is hypothyroidism?
Hypothyroidism, also known as underactive thyroid, is a condition where the thyroid gland doesn't make enough thyroid hormone. Your thyroid and the hormones it produces are important to your overall health because they influence almost every function in the body, including your body's metabolism and rate of energy burn. When you don't have enough thyroid hormone, many of your body's functions can slow down. The symptoms of hypothyroidism can be hard to spot. For one, symptoms can come on slowly. They can also vary quite a lot from person to person. Some of the common symptoms of hypothyroidism include tiredness, feeling cold, constipated, depressed, memory issues, changes to menstrual periods, and weight gain. Many of these symptoms can have other possible causes, which is another reason why hypothyroidism could go undiagnosed if not tested. If you think you're experiencing any of the symptoms of hypothyroidism, talk to your doctor about being tested because treatment is available.
What is the path to diagnosis for a person with hypothyroidism?
If your doctor suspects you may have hypothyroidism, they will start by ordering blood tests. The first test is called TSH, or thyroid stimulating hormone. This is the hormone that comes from the pituitary gland in your brain that tells your thyroid to make thyroid hormone. You can think of the TSH as a thermostat test. If it's too cold in the room, you turn up the thermostat. Similarly, if your thyroid gland isn't making enough thyroid hormone, the TSH turns up to try to push the thyroid gland to make more. If your lab test shows that you have high TSH, your doctor will likely repeat the test along with measurement of the thyroid hormones themselves, the main one being free T4, to confirm a diagnosis of hypothyroidism. Rarely, failure of the pituitary gland to make TSH can cause hypothyroidism, in which case the lab results look different from what we've talked about so far. Remember that talking to your doctor about symptoms you are experiencing is the first step to getting any diagnosis. You are at an increased risk for hypothyroidism if you have a family history of thyroid disease or have an autoimmune disease like type 1 diabetes or celiac disease. So it's a good idea to bring these things up to your doctor if you're experiencing symptoms of hypothyroidism.
What is the treatment journey for a person with hypothyroidism?
The good news is that once you have an official diagnosis of hypothyroidism, effective treatment is available. The treatment for hypothyroidism is typically with levothyroxine, which is bioidentical thyroid hormone. It's a medication that's taken by mouth once a day. Levothyroxine increases your thyroid hormone levels to a normal range, and after taking it for a week or two, most people start to feel better. Different people need different doses, so there are a wide variety of doses available to suit individual needs. Your doctor may start a lower dose to begin with, and then adjust it gradually, usually based on monthly labs, until the thermostat TSH test is normal and you're feeling better after you begin the treatment. Your doctor will then periodically measure your TSH to make sure your levothyroxine dose remains the most appropriate dose for you. It's important to note that levothyroxine needs can change over time and can also increase with weight gain and decrease with weight loss. For most people with hypothyroidism, levothyroxine will be a lifelong treatment.
What are physician organizations saying about treatment consistency in hypothyroidism and why?
It's important to stay consistent with your levothyroxine treatment to maintain consistent levels of thyroid hormone in your body. You should take your dose once per day at the same time every day. It should be taken on an empty stomach at least 30 minutes before breakfast. Food and drink can affect how your body absorbs levothyroxine. Although it's not recommended to take it with food or drink, if you do take your dose with food or drink, be sure to take it this way each time. It's important to be consistent with how you take your levothyroxine. If you're using other medicines, your healthcare professional may recommend that you take levothyroxine 4 hours before or 4 hours after these other medicines. All of this is to ensure reliable and consistent absorption. Be sure not to take it together with vitamins or other medications that can interfere with its absorption. 3 of the most respected physician organizations that focus on thyroid conditions, the American Association of Clinical Endocrinologists, the Endocrine Society, and the American Thyroid Association, agree that individual patients should consistently take the same formulation or product of levothyroxine. These organizations note the importance of doing so because between products there are different tablet formulas, liquid formulas, and added non-medicinal ingredients which could potentially impact the precise dose of levothyroxine you're taking. Staying on the same product means you're getting the exact same medication and dose of thyroid hormone each time you refill your prescription. If you do need to change between levothyroxine products, it's important that your doctor retests your TSH a month to 6 weeks after you start the new product to check that your hormone levels are normal.
What are the potential risks to keep in mind while switching between levothyroxine medications?
Well, changing levothyroxine medication products is not recommended in any patient to ensure a consistent medication dose and to keep your thyroid hormone levels normal. This is particularly important in the elderly, those who are pregnant, kids, and people with heart conditions, as changes in thyroid hormone levels puts these patients at a higher risk. Sometimes a pharmacy may switch a brand of levothyroxine without you or your doctor knowing it has been changed. Changing products may lead to a higher or lower level of thyroid hormone in your body. We talked about symptoms of too little thyroid hormone already. Having too much thyroid hormone in your body can cause a person to feel hot, have palpitations, anxiety, fatigue, problems sleeping, diarrhea, or unintentional weight loss. In addition, switching products increases testing costs, as the TSH has to be rechecked every time a person is switched from one formulation to another. In summary, levothyroxine is a medication used to treat hypothyroidism. Levothyroxine comes in several different formulas and products, and it's very important to consistently take the levothyroxine product prescribed by your doctor. Always check that your pharmacy has dispensed the product that your doctor prescribed.